Good morning, everyone, and thank you for joining us on this week's webinar. One announcement I'd like to make before we get started. We have been posting the recordings of each weekly webinar as well as the Q&A document for 11, 12 weeks now. One thing that we're transitioning to moving forward, we know that the questions that are coming in have been fewer questions each week as we continue to refine processes and guidance and direction. With that said, we will continue to leave those Q&A documents that have already been posted out there with the recording, but we are trying to transition into a more fluid FAQ document that should be easier to navigate. We'll be looking at how we can combine some of those similar questions or identical questions that have came in over the week to make sure that you have a guidance or a FAQ document that is current and up to date, and you're not having to go through multiple documents. But again, we will leave those that are already posted there if you want a quick reference or you know that where to find something specific or to check what was happening in that moment in time. So with that said, I will turn it over to the team.
Good morning, everybody. Heike, I sent you those links. Do you have those yet?
Yes, I have them, and I have them pulled up.
All right. Can we go to the health link first, if they're just front-facing COVID site? And Heike's going to drive, and I'm going to talk through it. So everybody knows how to get to Health and Senior Services COVID site. It's just at healthybo.gov. It's the first thing in their banner on the top. You hit the COVID. And what I want Heike to do now is I want her to go over to on this side where it says Missouri testing site, under COVID-19 down to Missouri testing site. And then this is all the testing sites in the state, but what's really cool about here is that second bullet underneath, right before you get into all the testing sites, it's additional communities around Missouri are conducting community testing events. Click here, and it's going to take you out, but that's okay. We want to go out for that. And this gets updated. So I sent out something to the downstream providers yesterday, and they had just added Buchanan County. So from the time that I sent that out at, I don't know, 3 o'clock yesterday until now, they have added, after Buchanan on June 9th, they've added Sykeston and Scott County, Platte City, Platte County, Dexter, Van Buren, Donovan, and Peculiar. Now, can you click on the Sykeston one and go in, Heike, for me? So this is just all the additional community testing site locations that are going to be available for everyone. And it's really important. This is just another opportunity for you to get tested, for your families to get tested, for your staff to get tested. It's free, and it only matters if you're a Missouri citizen. That's the only requirement in these places. So if you look on here, you do need to register. This is the registration process. Also, it'll tell you where the testing is going to be at. So this one was June 4th, so maybe they don't have it completely updated yet, because if that's sites, then that's not where the testing's at. So you may want to come back and check on that one. But also, I just wanted to make sure you guys kind of understood how that community testing registration process works. I will do my best to send out, as we know that it gets updated to the downstream providers. I know that our nursing and PR staff are looking at this regularly. They will send it out to you too if I don't find it, but also feel free to take a look at this site regularly. And like we said earlier, follow your local public health agencies, sites, Facebook pages, social media sites, because that will also help you find that. Okay, Heike, can you navigate back to that Missouri testing site? Yeah. And then go ahead and navigate back to that home page, that COVID-19 page. I think one back will do that. The other thing I wanted to show you off this page is under that analytics part. So in that gray box over there, if you'll push the analytics button. So there's an analytics update, and we added one for June 3rd. This also went out to our downstream providers also. These will be updated every week, and this is that really, really technical analytics update about what we know about COVID-19 in Missouri. Can you scroll down, Heike? I'm not going to go through all of these. I do want to show you a couple of the county maps, but we'll scroll down just so you guys can see this. It looks at ED visits. It looks at visits that are flu-like. It looks at visits that are COVID-like. Keep going. But this is the data that the Fusion Cell uses to help make decisions. Yeah, keep going, because I kind of want to get down past this to some of the state, where they got the state of Missouri by itself twice. Okay, right here, this is good. So COVID-19 testing volume and percent positivity by county. So you want to see less than 10% positive in your county. That means enough testing is being done. If you have more than 10%, they will be working on getting more testing into your county. So that's something to take a look at. Also, tests conducted per 100,000 population. That just a high number there means they're doing a lot of testing in your area. So scroll down. Keep going, that's lab capacity. You know, there's a lot of, this is one I like too, cumulative by county cases. So that's total cases by county since we started in March. While it's good, we all know if you'll scroll to the next one, what's really, really good. Oh, and I'll actually go back to this one because we did have some questions on this map yesterday. So you go back up to this one. Okay, there we go. Cases per 100,000 population. If you read down here, go to that third bullet, it says highest case count, 100K in Saline County. That means that's case count per 100,000 people. So that does not mean that there's 1,171 cases in Saline County. That's not true at all, but per 100,000 people, if there were 100,000 people in Saline County, there would be 1,171 cases. The same for Sullivan County, so we did have a question about that yesterday. That's not 964 positive cases in Sullivan County. If Sullivan County had 100,000 people, there would be 964 cases there. And you do that so that you can normalize what that looks like across the state. It kind of takes that population barrier out of there. So wanted to make sure you guys understood that. So if we can go to the next slide. New case growth. This is the one that you really need to be looking at. And one of the ones that I like most on this is that counties by 7-day % increase in COVID-19 cases. So this is where the new case growth is happening. The map I like a little less, but the one next to it is counties by 7-day rate of change in COVID-19 cases. The reason this map I like it a little less is that it shows counties that are decreasing, and that's true, counties are decreasing. But if you look at counties like Buchanan County, they still have a steady trend of cases. So they don't have 80 in a day now, but they're still getting 15 in a day. And so it shows as a decrease on that map, but you still need to go and look at those daily case counts to really understand what's going on, which is why we like that map that's next to it, because it still shows a 7-day % increase in COVID cases. So, okay, scroll down. We're not going to go through the rest of this. It's a lot of technical data, but it is out there for you guys to look at. This will be getting updated every week, and hopefully more new maps will be getting added to it so that it's more useful for you or continues to be more useful for you. And we can go, I'll let her, okay, we're good now. Now, Heike, can you go to the news release that I sent you? Because this goes back to community testing. I probably should have done it all together. The news release is, yeah, your third tab, fourth tab now, fourth tab. Good driving. Oh, no. It was the news release. She's working on it. Anyway, we'll also send out today, and she'll get it pulled up here. There is a news release from the Department of Health and Senior Services. They've actually identified 22 counties that community testing will be happening in over the next 2 weeks. So, oh, there it is. So if you go down there, it shows you counties hosting upcoming community testing events are Scott, Platte, Stoddard, Carter, Ripley, Cass, Franklin, Johnson, Pettis, Lafayette, Ray, Warren, Carroll, Sheraton, Lincoln, Lewis, Montauk, Pike, Scotland, Montgomery, and Osage. And Heike just highlighted that on there. So again, we just showed you kind of how to make those appointments, but wanted to make you aware of these community testing options, and those will continue to grow. Also, testing at the state level and kind of where we're at and where we've been and where we're going. We did complete with our state employees that work with facilities, state-operated programs. That includes our community support agencies that support the ISLs. We did complete over 5,800 tests of our employees from May 20th till June 2nd. Actually, 5,814 tests. We found 27 asymptomatic positives in that process. So in 9 locations throughout the state, some of those locations were locations we had already had positives in. So just to kind of give you perspective about testing and how important testing is, we didn't find a lot of positives, which is great. We were able to implement outbreak testing where we did find those asymptomatic positives, so we got more testing done of residents. We're also on our outbreak testing process there. So in 7 days, we'll test all those folks that were part of that outbreak testing again. But I know that there is some anxiety around doing testing, and I just want you to know that really in places where we expected to find positives, we found positives, but in places where we thought we would likely see positives, we did not get any. And there is value in knowing that you have all negatives. It allows you to start moving to those next steps. For us, that next step is more of a surveillance testing. So we will be moving to testing between randomly selected 10 and 12% of both residents and staff that work in our state-operated programs over the next 10 weeks. Actually, we'll get that done in 8 weeks because we will oversample just to make sure that we can get that done. Those will be random tests. So staff and residents will be selected randomly to be tested. If you've been tested, we're not going to probably test you again. Our goal is to really get everybody tested again through that process. So if you test the first week, you won't test again unless we need to test you for outbreaks or unless we need to test you for another reason. So that I just wanted to give you guys an update on what our next step, our really phase 2 in those facilities is as we work toward trying to get people re-engaged into the community. Also looking at what we're going to be doing with our staff as summer gets here and we're able to allow people to take some vacations, get some time away, what kind of testing processes we'll be putting in place when they return to work. We're still working on that, so we don't have that finalized yet. But the other good thing I want to tell you about that testing that we did, we've done all of our outbreak testing, and so far we've not got a single positive resident from that testing. So we have 27 asymptomatic staff that tested positive, but our outbreak contact tracing type testing has not revealed any positive residents. So testing is important. Keeping testing going is important because that keeps it out of your facility. The other thing I want to say about that 27 number that I really think is important, and I know I preach prevention every week, but part of the reason why we had 27 asymptomatic positives is because our screening processes are working. We've got to keep doing that. Masks are working. We will keep doing that. And then the sanitation of the locations and the hand washing, all very, very important. So we cannot forget the importance of prevention at this point. That's testing. Let me see, what else was I going to talk about? I don't really have a budget update at this point. I do know that there were some questions. In early May, CMS had put a request out to the states to submit their Medicaid payroll, so to speak, by provider. So Missouri did that. All states have done that. All those Medicaid payrolls have been accepted by CMS. We were hearing rumblings that they were going to announce, and they wanted to do that because they intend to make available through the Provider Relief Fund that was under the CARES Act dollars for those Medicaid providers. We heard through the grapevine rumblings that that announcement was going to be made last Friday. It was not, and we've not heard anything since then. So we want to hear that as much as you guys want to hear that. So as soon as we hear something, we will make sure we push that out for everybody. But we have submitted all the requested data the state has. I know a lot of states are requesting that. We don't know when CMS pushes this out, we don't know how they will do it. If they do it the same way they did the Medicare push out, if you're an electronic funds agency, all of a sudden you just have a drop of cash a deposit of cash in your agency. And that's what we had on the Medicare side here at the department. So I don't know how it's going to show up. We continue to ask CMS, please let us know how it's going to show up. Please let us know what our providers are getting, because I know all the states are trying to plan for other ways to support provider agencies, because that's very, very important. So that's kind of budget that I know right now. Fusion update, that was testing update. I know we're working on the community side to start our testing with community providers. Our first choice of partner right now is the federally qualified health centers. So we're going to try to get everybody hooked up with one of those first. If that doesn't work, we'll work with those local labs to try to figure out how to get testing done for our community providers. This is residential at this point, and we are starting with residential group home or any residential provider that has had positive results. And we're also trying to start with those efforts focused in areas that we know to be a little bit more active case-wise right now. The reason we can't do everybody all at once
is there is only so much lab capacity. And we've talked about this before. Testing has 3 prongs. It's got lab capacity, it's got materials, and it's got the actual ability to get the test done. And so there is only at this point so much lab capacity in Missouri. We don't want test results to take more than 72 hours to get back to folks. So we have to kind of, I don't want to say control, but kind of really plan those resources as well as we can. And we're also, I mean, at the same time that we're doing our testing, the nursing facilities are doing testing. Community sampling is happening, like we showed you, all of that community sampling that's already occurred and will continue to occur. Hospitals are reopening, which is putting pressure on labs. And then there was just the regular cadence of testing that was already going on. So and testing is important. I cannot get that across enough. And testing is not a one and done thing. So we will be testing and testing and testing until we have a vaccine. And I think people just need to get ready for that and try to figure out how that testing works best for their agencies. We're all learning from each other at this point. So that's testing, that's the Fusion update, but I am grateful through the regional office staff, they are working with those providers to try to get that set up. It's not gonna be as fast as you want it to be, but it's gonna be as fast as we can have it be. So I always want us to exceed our expectations, but I also know at the same time that there is only so much lab capacity out there, and we have to be cognizant of that. And testing capacity. So I think that is all I've got. Yes, Wendy.
Questions on testing. So what did you do with the 27 positive staff that you found?
Yeah, they go to quarantine just like normal. So they are off-site. We do not quarantine, and I want to make that clear. So we do contact trace everybody they've been with, but since we had tested everybody and they tested negative, we do not quarantine those staff. They still continue to come to work. So only staff with a positive go home. And what we'll do is we'll test all of those staff were initially tested. Any other contacts that hadn't been tested will be tested too, and then we'll test all of those folks again between 5 and 7 days. And then when these folks come back, they have to have 2 negative tests before they can come back to work. And that is how we do it right now, today. So that was a good question. And then there's another question. Resident testing at this time is optional and not a DD requirement to open to visitors. That is correct. It is not a requirement. Planning is a requirement. I know this, and my days get mixed up here. I know this week or early last week, they are working on guidance to help nursing homes get opened up. And I think that's going to be good guidance for us to follow too. We also saw some guidance around assisted living facilities opening up, child care facilities opening up. But some of the stuff that they're working on around opening up is, can we allow outside visitors? And what's the safest way to allow outside visitors? Because this is the time of the year where you could meet with somebody outside. We did share some guidance back because they wanted to say outside visits are okay as long as they're 6 feet apart and both parties are wearing a mask. We just want to make sure people understand that both parties can't always wear a mask. So what are some options there? So we continue to look at that, and that's something that is a priority of the state at this point because we do want to get people back together. I will tell you, though, that our positive test results yesterday were 290. That's a high number of positive test results for the state of Missouri in one day. Part of that's because we're doing a lot of testing. I think a lot of those are asymptomatic positive test results, which is good because we're catching them early. But just keep those things in mind as you're thinking through how you reopen and reengage in your communities. And again, I have to go back to prevention. It's still important to social distance. It's still important to wear a mask. It's still important to wash your hands. And that's while you're at work and while you're at home. So just please, please remember that. Okay, she's putting another one up there.
Yeah, so these are numbers of this.
Oh, yeah. So as of this morning, in terms of folks that group homes and residential providers on the DD side that we've been able to contact and work with, we've got 554 individuals and services and 1,422 staff that are wanting to participate in our community testing. That's 1,900 people. That's going to take us a little while to get done. But we'll continue to grow those lists. We're going to continue to collect that information and continue to connect folks with testing resources. So, okay, I think that's all I've got. Now we'll go to Gary.
Okay. I just have one thing. We had a question from last week about the stimulus checks coming on an EBT card. So we have confirmed that there are about 4 million Americans are going to receive that on an EBT card, and it's basically because the IRS doesn't have your account information, and your tax return was processed through one of two specific places. So I guess someone's in trouble there, but yeah, it's just specific situations, and it's not a lot of people, but it is going to happen.
Who's breaking the Station MD news?
Ooh, you can.
Station MD.
Station MD, we have gotten approval from the budget office to extend Station MD until December. We've got a little contracting challenge that we've got to work through, but hopefully we can get that done. But there is support for us to continue our Station MD effort through December at this point in time as an emergency service that's beneficial. So right now it is hopefully going forward through December again, and you guys are familiar with state government. We will work through that contracting challenge. So.
All right, with that, I will turn it over to Kim.
Just wanted to piggyback on Val's emphasis around testing. So those of you, and thank you for your quick response back, our community providers that we've reached out to, you'll be hearing from us directly here shortly on our attempts to connect you with your local federally qualified healthcare centers who will be supporting those testing efforts. They have been great partners with the division, and we greatly appreciate that. Also, just a quick note, wanted to give you a good example of why we're doing and emphasizing testing, because we support some of the most vulnerable individuals through our residential services, and individuals who are at a greater risk for severe illness due to getting in contact with the virus can have very serious and negative outcomes. And so that's really why we're emphasizing testing right now. What we're seeing with the testing efforts right now is a lot of individuals are asymptomatic, and what that means is that you're not aware that you have the virus, and so you could unintentionally expose one of our residents to the virus. So that is really kind of why we do the efforts that we do. Also, a good example of this is we have had a situation in one part of our state where an agency had a support person who tested positive, and they were supported. The agency was diligent about going ahead and making sure that the participants or the residents were tested. As a result, one of the residents did test positive. For all intents and purposes, they were not experiencing any external symptoms, and so the agency, again, was very diligent in their monitoring and doing activities such as checking their pulse ox. They were having some results with that, so they consulted with the individual's primary care provider and did some further follow-up. And again, that led to the individual actually being further diagnosed and needing further treatment. So we can't emphasize enough how important testing is, how important the diligence of monitoring is, and supporting the individuals that receive our services. So I just want to, again, thank everybody for all of your efforts and everything that you're doing, and we look forward to continuing to partner with you on these important efforts around mitigation. So I'll turn it back over to Wendy at this point.
Okay, thanks, Kim. So again, I'm just going to caveat one other thing with testing is, although it's not required, and it can be an important part of planning as you're talking about reopening your programs and day programs and employment programs and those kinds of things. Imagine the sense of confidence that you have if you know that the folks that are coming back into your center have been among those that have been tested. It just helps with that planning. Another example, it's not a required thing, but it certainly helps develop a level of confidence for your staff and the families and the individuals coming back. So I just have some questions that I wanted to respond to, and they are around returning to day programs, returning to work, and kind of folks transitioning back from whatever their emergency placement was if they went home to work to live with mom and dad, and now they're transitioning back to where their permanent home is, group home, ISL, or whatever it might be. That what is the process going to be for returning those authorizations for the pre-COVID ISL budget. So we will continue to use the expedited UR to transition those folks back because, again, it has to do with COVID. The exception might be if you're really close to your annual planning meeting and it doesn't make sense to do this step and then you're turning around and you're having to do your annual review and budget. So take that into consideration. The annual review and budgets will go through the regular UR process, but take that into consideration so that you're not duplicating your own efforts or the efforts of others. So that can be an exception, a possible exception. Then the other question is, does the service coordinator need to amend the ISP? Well, that will depend upon what the transition actually is. So if you are changing services, if you are going from being at the group home or ISL 24/7 back to the day program, you are changing to a different service, so there will need to be an amendment. But if you are simply changing, you stayed an ISL service, but the address changed, but you're billing ISL in a different location, that doesn't require a plan amendment, but because it is the same service, the service didn't change. So I hope that gets at that question there. If not, please ask a follow-up question to the DD mail or in the chat. Who will make the adjustments to the Seymour budget? Those budget changes happen by the same people that have always been doing them. Whoever is responsible for entering those budgets into Seymour and into that system remain those people that will be responsible for doing that. And will the Seymour budgets be approved by the regional office or agency team lead? I'm not sure what is meant by the agency team lead, but again, the Seymour budget approval is the same process as it has been. And there is, and we will put in the answers to these questions, there's also guidance out there. You can refer to the guidance on the website about the UR process changes necessitated by COVID-19. State of emergency was posted on 3/24, and there is more information about all of those questions on that document, so that might get at what your question is too. Otherwise, again, post a follow-up question. And then the last question is, it is unprecedented time for us all as we've learned to navigate this new normal to keep our consumers and staff as safe as we can from following changing CDC guidelines and handling COVID-19 positive consumers or staff. Emergency staffing situations have been utilized. Are provided hours still expected to be tracked and reported on the same basis as before during the pandemic crisis? And the answer is yes. There has been no change to any of the tracking or reporting requirements for staff hours. So that is all I have in terms of questions, and I'm going to turn it back over to Val.
All right, thank you. We had one more question come in, and I probably should address this under testing. I'm sorry I didn't. So in our state testing, we had 27 positives. 6 of those positives that we had were people that had tested back to work with 2 negative tests. So they had been positive previously. We had given them 2 negative tests at 24 hours apart. They'd come back negative. And when we did the full testing again at the facility, they came back positive. With those staff, we sent them home for between 5 and 7 days. We retested them. If they test negative, we let them come back to work. There is a lot of evidence out there in discussion right now on how contagious were these folks, or were they even contagious at all. We are erring on the side of caution. There's some pretty good science out there that says they're probably not contagious. It's probably dead virus. But we're erring on the side of caution, and that is how we're handling what I have now termed them the negative positives because they were negative and now they're positive. But in our facilities, that is how we're handling them. So they go home for between 5 and 7 days, then we retest them again. And if they come back negative, then we allow them to come back to work. So I'm glad that question came in. That was a great question, and I should have addressed it, and I didn't. So now I have. I am going to share a story from the field, a Frontline Heroes story before we close, because we want to end on we got some amazing people out there, and this doesn't end soon, and we're going to have to keep with the prevention, and we're going to have to keep with the testing, and hopefully we get some better testing options, and it's not always that PCR up-the-nose test, but we have to keep doing all this stuff. We have to stay vigilant. It's going to be a big part of our lives. Actually, Mark just walked in. Do you want to say anything?
Good morning, everybody. Just to ask you to continue to be vigilant, diligent, or whatever.
Diligent's good, too.
That's a good word. We heard a story this morning from another department that had its first person test positive, and this person's story was that he had been to a church service, and the pastor notified everyone later that he had tested positive for COVID. So this person who had gone to the church service went home and infected a number of members of his family. So, you know, there's 2 lessons there. One is the whole social distance issue, and the other is that the pastor apparently wasn't feeling well before the service started, and yet did the service anyway. And the lesson there is, if you don't feel well, go home or stay home. That's really important. So there's just a couple of things there to learn from that particular story, and be safe.
Yes, the virus is still active. So our Frontline Heroes story, Kevin B., he works in St. Louis. When I think about Frontline Heroes, Kevin is the first person I think of. Kevin has been with the agency for over 30 years and has worked in different houses and different roles. During the pandemic quarantine, other teammates were concerned to take someone to the dialysis center 3 times a week. Kevin stepped up to the plate and changed his schedule so he was available to take a gentleman to all treatments. After 4 weeks of doing this, the other gentlemen in the home Kevin supports were becoming upset because they were not getting to see him as much. Kevin asked if he could switch things up again so that he could still go to dialysis, but also have some time with the other guys in the house. He even came in on his day off to barbecue with his buddies. This gentleman ended up becoming ill and needed to go to the emergency room. Kevin volunteered to take him and stayed outside until they asked him to come in and be with him. Kevin put on his mask and stayed with the individual until he was moved upstairs. When this person ended up having to be transferred to hospice care, Kevin visited him every day, even on his days off, and brought him his favorite foods, including cut-up hot dogs and cheesy scrambled eggs. When asked about this, he said, "I'm just hanging out with my friend. I could not think of a better Frontline hero than Kevin B." So, yay! Can't look at Kim. She's crying. But, yeah, I didn't read it beforehand. That was probably good. Okay. So thank you guys for all you do. Well, we had 436 of you on the call today, and we look forward to chatting with you again next week. Keep up the good work. Bye.